Most infusion reactions will occur with the first infusion. They generally will happen as an allergic type reaction, similar to other monoclonal antibodies we use, such as rituximab, for example. With daratumumab, they tend to be somewhat uniquely involving the upper respiratory tract system. So rhinitis, tearing up of the eyes, even wheezing and stridor can be notable. And those are infusion reactions that require the infusion to be slowed down and stopped, and then restarted again at a slower rate if they occur and require further medication to alleviate. A very important aspect of the use of daratumumab is that it can interfere with red cell cross-matching for transfusion. It's very important, therefore, that each patient to receive daratumumab has a cross-match performed ideally before they take the drug, and that's an important parameter to remember as people are starting this treatment. If one forgets to do that, there are techniques the blood bank can use to diminish that cross-reaction that occurs in the lab. If you let them know the patient is on daratumumab, they can work around that, but really it's better to do it before the drug starts. The pan-reactivity of daratumumab interfering with a cross-match will last as long as daratumumab is present within the bloodstream. So technically, once the patient is on the drug and you're continuously delivering it, it's going to be a problem throughout the treatment course of that patient. So really, one does have to do this cross-match before the drug starts. If the patient has started the drug and you still need to do a cross-match, the AABB has released recommendations to overcome this using the reagent DTT, which can reverse this phenomenon, but the blood bank needs to be aware that the patient is on the drug when you send the sample. For both monoclonal antibodies, the patient needs to be aware of the duration of the infusion, to understand that it may take a whole day and it may be every week for a while. They need to understand that infusion reactions can occur, particularly during the first infusion, that they will be pre-medicated against those, but they need to be warned that they may happen and to be aware of them. They also should be told that those infusion reactions are unlikely to occur with subsequent infusions and that generally these are well-tolerated drugs. Other things to watch out for include low blood counts, particularly neutropenia, that can lower their white blood cell count, and patients need to be informed to be aware that if they do develop fever or signs of infection, they need to alert their provider.